Hi, in this module, I will help you learn about your atrial fibrillation, or AFib for short. First, let's talk about the circulatory system. The heart and all the body's blood vessels are part of what we call the circulatory system. The system works in an organized way to pump blood throughout the body. The heart is a hollow, muscular organ about the size of your fist, located in the center of your chest, tilted towards the left. It is made up of 4 chambers or compartments. The 2 top collecting chambers are called the right atrium and the left atrium, and the lower 2 compartments and bigger muscular chambers are called the right ventricle and left ventricle. These 4 chambers squeeze and relax in synchrony to pump blood from the heart to send oxygen and nutrients to the rest of your body. This synchrony is controlled by the heart's electrical system. Electrical signals within the heart cause its squeezing action. These electrical signals start from a point at the top of the heart called the SA node. Each signal passes through the muscle cells of the atria, causing the atria to squeeze. The electrical signals from the SA node eventually pass through the AV node, and then to the rest of the heart, causing the ventricles to squeeze. A healthy heart beats around 50 to 100 times each minute in a regular way. We call this normal heart rate. At night, the heart rate can slow down to below 50 beats each minute, and when we exercise, it can go higher than 100 beats per minute. You have been diagnosed with a condition called atrial fibrillation, or just AF for short. Don't worry, as this is common. 1 in 4 people develop this condition in their lifetime. So what is AF? In patients with AF like you, the electrical signals in the atria are fast and disorganized. Because of this, the atria is unable to contract as a unit to push blood forward. Instead, its contractions become small and ineffective. This is what we call fibrillating. The abnormal electrical activity leads to, remember, normal heart rate is somewhere between 50 to 100. In AF, the heart may beat more than 100 beats a minute. It also leads to, in patients with AF, the atria and the ventricles do not contract in a regular rhythm. This is called arrhythmia. AF is very common. In Canada, about 350,000 people have AF. In British Columbia alone, 60,000 people have AF. You may wonder why you have AF. Things that can increase the risk of developing AF are called risk factors. AF risk factors are high blood pressure, that is, blood pressure more than 120/80, being overweight, having abnormal or damaged valves in the heart, having someone in your family with AF, being a male, having had heart surgery, being older than 65, having heart muscle problems like heart failure, or AF can happen for an unknown reason. Of course, some of these AF risk factors you cannot control, like your age. Others you can control, like your blood pressure and weight. Atrial fibrillation can be either intermittent, also known as paroxysmal, or it can be persistent. In paroxysmal AF, the irregular heartbeat and symptoms are short-lived. The episodes may come and go, or they may last seconds, minutes, hours, or even days. Usually an episode starts and stops suddenly on its own and lasts less than a week. In persistent AF, the episodes last longer than a week and don't stop on their own. The common symptoms of AF are as follows: palpitations, feeling like your heart is racing, skipping beats, or beating randomly, pounding in your chest. Remember, palpitations are a symptom of AF. They do not lead to death. They are uncomfortable, but they are not life-threatening. Fatigue, feeling lightheaded, dizzy, or feeling like you might pass out, feeling short of breath or weak after making little physical effort, feeling anxious, sweating. How many of these have you experienced? Symptoms of AF vary from person to person, and some people with AF may not have any symptoms at all. AF is a chronic condition. That means once you get it, it will be with you for the rest of your life. Surgical procedures can sometimes stop AFib. However, they are not always effective and they are not always the best option for everyone. While medications are very helpful in controlling AF and reducing the number of episodes, there are other things you can do to help it. Try to identify the things that may bring on your symptoms of AF and avoid them. These are called triggers. Triggers are not the cause of AF, but they can bring on an episode. Common triggers for AF are exercising too hard, drinking too much alcohol, stress, smoking, being dehydrated, drinking energy drinks, and taking more than 3 cups of coffee a day. Important things to remember about AF. 1. AF can cause both rate and rhythm problems. It can make the heart beat irregularly and at a high rate. 2. AF is not a life-threatening disease, but it is chronic and will be with you for the rest of your life. 3. AF symptoms vary from person to person. Some may be bothered by their symptoms, while some may not have symptoms at all. And 4. Triggers don't cause AF, but they can bring on an episode. Identifying and avoiding them may help your AF.